All right, good morning, everyone. We are going to begin. Thank you for joining the African Americans Reach and Teach Health Ministry, along with the Mountain West AIDS Education Training Center, who is bringing you this training this morning with Ryan O'Connell around enhancing healthcare for transgender individuals. I'm going to take some time to read Ryan's um, bio before they begin. So, Ryan O'Connell is currently a research instructor working with the Interprofessional Education Center, where he trains providers and health profession students to increase their capacity to work with transgender populations. In the past 2 years, he has trained over 1,000 students and healthcare professionals. He is also an adjunct instructor for the Colorado School of Public Health, a research advisor for the School of Medicine, an instructor and an academic advisor for the undergraduate programs in public health, a research a researcher for the LGBTQ Center of Excellence at Denver Health, and a PhD candidate in health and behavioral sciences at the University of Colorado. His dissertation is examining the experience of parents with transgender adolescents. So if you can just welcome our guest presenter, Ryan O'Connell. Ryan, are you able to share your screen with folks?
Yeah, let's try to get that going. Thanks for that intro. I usually do myself, so like I'm not so formal, so that was great.
You can also introduce yourself as well.
All right, let's see. Let me try to get this slideshow up there. Is that, can we see the slides?
Yes.
Great. All right, so I guess we'll just get started. So thanks for the intro and thanks for Art for inviting me to speak today. I've recently been listening to a lot of y'all's other presentations and they've been great. So I encourage everyone to participate in all of their teachings and presentations. So I won't give any more intro to myself. I have been working with AATCs for the past 8 years and just doing a lot of these like trans talks. So we'll just get going. And I know usually a couple of things before we get started. I just want to address managing expectations. So make sure we ask the questions that we have in the language that we have. Don't be afraid to ask questions. This is a learning space. Lean into your vulnerability and challenge your lens. So first, I'm just gonna try to get you all to participate as much as we can. I do like in-person things because I like to talk to folks. So let me ask y'all first, when did you first learn you were a girl or a boy and how did you know?
I believe you're able to unmute yourself if you want to respond.
I know folks aren't used to participating in online lectures, but I do a lot of teaching online, so we're gonna do it that way.
And if you find that you can't unmute yourself, if you have like one of those emojis where you can lift your hand or raise your hand, I can unmute you, I think. I saw someone.
Hello.
Yeah, hi. I figure it's that waiting game.
I'll go ahead and throw myself. Yeah, I'm sure there was something before this. I'm positive of it. But just thinking back, I think the first time that it wasn't the first time I realized, or it wasn't the first time that I learned I was a boy or a girl, but it was, I think the first time it just became really obvious about differences was when I was a small child on a playground. And the girls were kind of hustled over to this group to kind of talk. and the boys were in the field kicking balls, and they looked like they were having much more fun.
Yeah. So
And
you were.
yeah, and I was little, like little. I'm not much taller now, so it's kind of funny to say that. But I was young, and I just remember that was probably kindergarten or just first grade. Like I was really young, but I remember that. I just remember that there was just a difference between where we stood and what we did,
Mm-hmm.
and it was just really obvious at that moment.
Yeah, so you sort of learn that there's sort of specific activities that are related to girls and boys, and it might be different. And yeah, did you have any idea of where that was coming from or why that was the case?
Not really. I thought it was interesting because, like, in my family, I played softball with my father, like threw the ball and stuff like that. So in my home, I did I did what I saw the boys doing out in the field,
Mm-hmm.
and you didn't see any girls doing that. And
Yeah.
so it stood out to me because I thought, and interestingly enough, I thought I would like to go out there and play ball.
Mm-hmm.
Um,
Mm-hmm.
but even at that age, there was still something that in my mind that indicated to me that's not the thing to do. So
Right, right.
I think even at that age, I was still able to recognize around me that there were expectation differences,
Mm-hmm.
even at that age.
Yeah, thank you for sharing that. Does anybody else want to speak to maybe when they first learned that or how they knew?
Hi, I'll share. Um, so I think I first learned that I was supposed to fit into a certain box is when I was at my neighbor's house and I was like putting on dresses and just having fun. And then my neighbor's dad um, was like laughing and asking what I was
Mm-hmm.
doing and sort of just like pushing me into this box that like I really wasn't supposed to be wearing dresses.
Mm-hmm. Yeah, I think that's a great example too. So like, first we were talking about maybe activities that we were related to gender, and now we're talking about maybe the expression, the clothes that, is expected for certain genders, things like that. And we just sort of learn this stuff almost implicitly, or how the way people react to us, right? That sort of negative reaction was saying, oh, maybe this isn't something that should be happening, right? And so, or at least how they were sort of portraying that to you. So there are expressions, there are activities that are related to gender. Sometimes, when we first start talking about sex and gender, like when we talk about trans folks specifically, right, folks always start with what bathrooms folks should use. States have passed, a lot of times people will say, yeah, I knew because of my anatomy, right? States have passed bills that say folks should be using men's and women's bathroom based on, and this is quote from these sort of bills, the physical condition of being a man or woman, which is determined by chromosomes, anatomy, biological sex, sex assigned at birth. Folks making these laws seem to be completely unaware that intersex people exist in the United States. About 5 to 7 births a day include babies who have what's known as ambiguous genitalia. That's the same number of redheads that we see per day. More are born with a variety of differences from what we define as normal internal and external genitalia, sex organs, and chromosomes. With chromosomes, there's this belief that we're XX. If we're XX, we're a woman, and if we're XY, we're men. But 1 in 20,000 men don't have a Y chromosome. And we don't usually find this out until we have a heterosexual cisgender couple, cisgender meaning we identify with the sex that was assigned to us at birth, wanting to get pregnant, and they can't. So we run mom through a bunch of tests and we decide it's not her. And finally we test dad and we find out he doesn't have a Y chromosome, right? So what does that mean? Maybe we don't need a Y chromosome to be male, but maybe we need a Y chromosome to make viable sperm. 30 genes are in the development of sex, 3 are in the X, 1 are on the Y, and the rest is somewhere else, right? This isn't an anatomy class, but the rest is somewhere outside of the X and Y chromosome. So maybe that means that sex should be more considered a product of a total genetic makeup. In the 1950s, John Hopkins used optimum gender rearing model. When children were born with genitalia that didn't line up with our standards, doctors would take it into their own hands to make their genitalia look normal. medical textbooks taught them to lie to parents and children and withhold medical history. With boys, the goal was size and function. With girls, fertility and reproduction. Sensation was never a goal, and most of the time they would cut healthy genital tissue because it was easier to take away than it was to add. It's subjective too. What's too small a penis or too big of a clitoris for someone to say it's ambiguous and decide they can't assign someone a sex? There was this belief that with early sex assignment, by about 18 months, you can make any child believe they were a boy or a girl if their genitals looked right. So this throws a bit of a wrench in this idea that anatomy we were born with somehow creates an innate desire to move through the world in a particular way. So, this is also this, when people say, I first knew I was a boy or a girl, is because somebody told me, like my genitalia looked a particular way. So let me ask you this. I'm going to ask another question. So hopefully folks will speak up a bit. If you woke up with different genitals, all else equal, would you identify as a different sex? Why or why not? So for example, if I identify as male today and I have a penis and tomorrow I woke up with a vagina, would I identify as female and start moving through the world that way? Or opposite, if I identify as female today, would I move through the world as male tomorrow? This is a harder question, so folks are usually shy to speak to it. All right, well, so it's hard for me to see if anybody's thinking about it, so we'll move on. So what happens usually here is I'll have a handful of folks that adamantly believe they actually would move through the world in a different way, but what most folks will say is actually they wouldn't. And so they start to see that there's this difference between our sex and our gender, how we identify, how we move through the world. So when we think about sex and gender, we have sex as assigned at birth, this biological aspect, right? What we usually think about when we think about biology and anatomy. And then we have gender, which is more the sort of sociological aspect of thinking about things, right? Gender identity being the relationship with our sense of self, our body, and how we move through the world and how that body fits in the world. Gender is socially constructed, meaning the cultural interpretation of what it means to be men and women in this country. What the two of y'all spoke to at the beginning, right? What activities we're supposed to do, what clothes we're supposed to wear as men and women in this country, right? And the characteristics, right? Those gender expressions and expectations that come along with that. The idea of sex and gender also as two different constructs is not new. The women's movement is where the conversation and meaning of gender became a term of social analysis. Discussion started happening around gender equity, gender roles, and what it means to be men and women in this culture. Gender theorist Judith Butler says gender is achieved, right? We have to be around other people to understand ourselves as a gendered person and to be read as a particular gender. The meaning of gender and gender expression can also shift based on time and place, right? Gender roles and expressions can change within a generation. It can be different on what country you're in the world, right? What culture you live in. In the United States, it could change in a time frame of generation, right? In the United States until the 1960s, it wasn't really accepted for men to wear long hair, right? And then it started to become more common for women to wear pants, those types of things, right? We often forget that these things, we forget about these things, these historical changes, when we think about what's normal right here, at least in the Western world. We also see that, these sort of gender roles have changed over time. So this is an actual ad from the 1950s. It says Van Heusen ties for men only, brand new man talking power pack patterns that tell her it's a man's world and make her so happy it is. And so like if they ran this ad now, right, they would lose clients and people would be outraged. But this was a normal sort of idea of what gender roles looked like in the 1950s. Now we see ads like this, right? A kick right in the stereotypes, these Nike ads, right? And this one says, for running, not running errands. We make real performance products for real women who get after it every day. We have this woman in the front with this sort of running outfit on and the women in the back with the shopping bags and the carts and things like that, right? And we see it as women's empowerment when we first look at it, but they're still playing on these taken for granted assumptions about what's normal for women and the ways that they can express gender and the roles that they have in the world. So just to hear changes in ads over the course of 30, 40 years has changed our sort of spoke to how we think about the roles that men and women have in the world. And for those who haven't seen this picture before, can you describe this slide to me? What do you see in this photo? Everybody's walking around doing their dishes, eating their breakfast.
It's a young person with long hair.
Yeah.
Mary Jane's tall socks. Looks like
Yeah.
a dress.
Looks like a dress. And what might we assume about this person? Everybody's like, you're tricking me.
That it's like a little girl.
Like a little girl, right? Yeah, there's these cues that we see, like the long hair, the dress, right? These sort of gender expression that makes us think that, this is a girl. And so this is actually Franklin D. Roosevelt. So at this point in history, kids didn't get their hair cut until about 5 or 6. So most, young children had long hair. And this is what gender neutral, what we would use now, gender neutral clothing looked like at the time, right? White clothes were easy to bleach. It was easy to clean. And dresses made it easier to change diapers, right? And so if we put boys in this outfit now, people would be so angry, right? And why? What about that really makes people angry or makes people uncomfortable if their child gets misgendered or something? So I'm going to ask another question and see if anybody wants to chime in. But if we really want to start to disrupt this idea of biology dictating, what we desire when we assign a gender, why do boys wear blue and girls wear pink?
It probably had to do with something with money and advertising.
Yeah. I mean, that is the absolute answer. So I love that you went there right away. Usually people are dumbfounded. We don't usually actually step back and ask ourselves this question, but exactly. When department stores and fashion magazines started to take off, right, it was first accepted that boys actually wore pink and girls wore blue. These children's colors were sort of more pastel, so red being a decidedly stronger colors and pink being the pastel for that, right? And blue being seen as more dainty for girls. And over time, it switched to blue for boys and pink for girls. In the 1960s, it went away for a little bit to a more neutral style, but then came flying back in the 1980s. What happened in maternal child health in the 1980s that might have changed this? What was happening with moms and babies and maternal health in the 80s? Any providers?
Y'all gotta participate.
What's that?
I said y'all have to participate.
Yeah. We're only
So
participating at the beginning. Yeah.
can you ask the question one more time?
Sure. So in the 1960s, we moved away to a more neutral style, but in the 1980s, we really came back to this blue for boys and pink for girls. So I was asking what happened medically in maternal child health in the 1980s that you think prompted this change? All right, I'll give you all the answer. So what happened, right, was ultrasounds. We were able to see the sex of our baby before they were born. So affluent parents who already had a boy, for example, were now having a girl, could go out and buy a brand new set of clothes and toys. So like we just said, right, why do boys wear blue and girls wear pink? The answer is capitalism. The fashion industry told us that this was the case, right? And we've never bothered to ask ourselves why this were true, right? We've chalked it up to our biology making us want to move through the world in a particular way. And this is why boys wear blue and girls wear pink, right? And it actually is, it's 100% fashion and capitalism. And there's whole books that speak to this a little more in depth, but like we rarely question these things. And so with these ads, right, with these ideas, we can see that the meanings behind gender roles and expressions do change over time, and certainly across cultures and borders, right, and oceans, right? We have historically pathologized this difference in variety, but difference from the social norm is not a disease, particularly when we've created these norms, right? And so we might begin to see that we actually all understand our gender more through what it means, right, than through our anatomy or ways that the world is sometimes predicting that why those changes exist. So when we think about gender, right, we can think about gender in two ways. It's best understood in two parts. So gender expression that we talked about, right, that Robin and Hunter spoke to, you know, like the activities that are around us, the clothes that we're wearing, you know, our demeanor, the other, you know, maybe the way that we cut our hair, something that's how we relate to gender. And then gender identity, which we'll talk a lot about today, how you sort of in your head and your heart define and understand your gender based on the options that are given to you or that are you known to exist, right? And your relationship with your sense of self and your body and how that fits into the world. And what's so interesting is we actually all have a range of gender expressions all the time, right? Our range of masculinity and femininity may be different based on the time of day. So for example, we may have a more, you know, masculine appearance in the morning, or baggy sweatpants or baseball hats or something like that, right? And a more feminine expression when we go out to dinner in our dress or heels, something like that, right? So we all express both masculinity and femininity in some way all the time, regardless of our gender identities, right? We're just not taught to think about it that way. And we're funny about it too, right? Who can express gender and in what way? And again, the two examples at the beginning sort of nail this, right? We love tomboys. We have a lot of space for young girls to sort of express more what we would see as like these masculine gender expressions, like play sports, you know, like those types of things. We celebrate that. But in this country, it doesn't have a lot of space for what would be seen as femininity in men, the dresses, right? The more feminine sort of expressions, things like that. We react to it in a different way. So we have a little bit of a different reaction to how we allow people to express that gender. And as children, you know, we learn this very limited concept of gender, right? You know, that boys on the left, you go, you know, go play over here. Girls on the right, you know, go play over here. You know, boys play with trucks and footballs. Girls, you know, and wear blue and, you know, whatever. And girls wear pink and play with dolls and be gentle, right? Be a mother. And I think sometimes when folks are having conversations and raising awareness about trans folks, right, and expanding their ideas of gender, they think that we're saying these ideas are wrong. When we're not, right? The definitions may very well describe some of you listening today, and that's okay. The problem here is that if you counted, there are only two options, right? Two options for a way to be in the world, two options for everyone, you know, on this call to be, two options for 7 billion people in the world. And where this starts to break down is that we assign these gender roles based on a few traits that somebody is born with. And then based on that, we assign an identity and expect them to move through the world in a certain way and grow up in a certain way. And we forget that we've socially created them and disguised it as biological imperative. And so gender is more about what's outside of you, right? It's more about what's between your ears than what's between your legs. And once we grasp this idea that people express and identify with gender in different ways, there's this idea that these concepts sit on a spectrum. And we often see this spectrum, right, for gender identity, gender expression, you know, even sexual orientation, those types of things. And the weakness in this model is that it suggests that if you're more of one, you're less of the other, right? So if we had to stick ourselves somewhere, like gender expression, I think is the easiest way to think about this. If you had to stick yourself on that spectrum, right, then it does suggest a, you know, either or type of thing, where in reality, you know, it looks a little bit more like this, where we see that, you know, these boxes, right, sort of in binary starts to obscure the forms of gender people can and do demonstrate. And in reality, you know, we kind of all sit on a spectrum of both all the time. It's more of a both and than an either or. And so, you know, being more masculine doesn't necessarily make us less feminine or the other way around, right? And so nature really loves variety, but society not so much. And so here we can start to also break down this difference between our, again, our gender expression, our outwardly appearance, our gender identity, how we identify, our attraction here, our sexual orientation, who we are attracted to, and then sex, which is based on anatomy. So this just starts to break down this a little bit. You'll see the sort of conflation of gender identity and sexual orientation quite a bit. Even in, like for those of you that are privy to like the scientific journals, we see this like sort of acronym LGBT a lot, lesbian, gay, bisexual, transgender. And most of the time when we see that acronym, folks are talking about sexual orientation, not about gender identity. So trans folks do have sexual orientations. So we have to make sure that we don't conflate that. We have to do, if you're going to use that acronym, let's make sure we're talking about both sexual orientation and gender identity. So the whole point of today, of course, is to talk about working with trans folks. And so when we talk about trans folks today, we'll use this general understanding. So it's an umbrella term for transgender communities in the 1990s. Usually for people whose gender identity is not the same as the sex they were assigned at birth, and includes a variety of gender identities that fall outside of current dominant Western cultural values and ideas of what it means to be male or female. So I'm going to ask one more question. Where have most of your initial impressions or exposure to trans and non-binary people come from?
Probably from the media.
The media, yeah. So can you speak to some of maybe the media that you've been exposed to?
I'm trying to think. I tend to be somebody who like looks for things that are not necessarily like put right in front of me.
Yeah.
But I think the first time that I remember seeing somebody where like the character and the concept of transgender came together was in Orange is the New Black.
Mm-hmm. Yeah.
And
Okay. Yeah.
But I know that there's a documentary right now on Netflix that just came out, and it talks about the history of the portrayal of transgender people in media and in movies and TV, and how that has impacted their treatment. But for me, like the first portrayals were largely like people who were portraying, like who were like in the transgender community, who were just like portraying characters in a show, and it wasn't a show where they were like the transgender character, and that was what it was about.
Yeah. Yeah, great. Yeah, I think, media is certainly, Orange is the New Black comes up a lot, the way that people have talked about like Caitlyn Jenner's, maybe some exposure people have had, right? Or the characters that we see in TV shows. I haven't seen that documentary yet, so I'm gonna look that up. So other comments, anybody else, where your first exposure, the first time you've heard that, trans people exist? All right. Well, we got one. So thank you, Casey, for commenting. So yeah, definitely media, right? Lots of folks' initial understandings come from media. Everyday life is drenched in media, right? Social media, phones, TV, headlines, right? Media often serves as the vehicle that many people, including trans folks, are first exposed to trans subjectivity. And what we see in the media is that trans characters are often cast as in the victim role most of the time, as killers, as villains. The most common trans characters are depicted as sex workers. We see a lot of anti-trans slurs and language and dialogue in most of the episodes and things like that. Storylines, we are seeing a change now, or seeing more positive portrayals, but for the most part, this is what we see for a really long time. And CSI, featured a trans serial killer who murdered his own mother. Scenes of trans murder victims were openly mocked by the show's lead characters. Shows like Nip Tuck featured a storyline about a transgender woman who regretted her transition. We saw an entire season about a psychopathic trans woman depicted as a baby stealing sexual predator. who slept with her own son. So these are the sort of storylines that we have historically seen for trans people. And then like in a, a society that's really drenched with these like headlines, these sort of what, like 40 character things that people interact with the world with, Twitter, social media, things like that. We see headlines like this. Jake, who used to be a woman, weds Hannah, who was a man. And they're both sort of famous officers out of London. And these are the kind of like headlines that we see. And so the media, or, this is the picture on the bottom right, it says officer and a gentlewoman. So sort of playing on that like gender thing. This is Hannah. And so they have her sort of pre-transition photo there. And so, when we see these headlines, media doesn't present trans folks as simply who they are or the gender that they identify with. They always say things like who used to be a man or something like this. So this is the way that people are usually exposed to trans folks. And the media in particular, it does shape discourse. It does shape the way that we talk about things and the set of ideas of how we understand things. And I call this the green sky analogy. So green sky analogy, meaning like there are some things that we all know about. We all know that the sky is blue, for example. And if we saw that on TV and the sky was green, we would know that that was an inaccurate representation of the sky. But there are most things that we don't know about. So when we see it on TV or in the media, we don't know that it is an inaccurate perspective or a wrong perspective, something that we're seeing like. Trans folks in particular are vulnerable to external definitions, and trans imagery is typically produced and circulated from outside communities. So when we don't understand things, we tend to put them in boxes and we apply a particular understanding to them. And that's usually based on this sort of limited lens. And so that happens quite a bit. So it's important to kind of step back and ask ourselves, how we know what we know. Where did that come from? How we step back to thought or, sort of question our thoughts about the truth of the world. And so oftentimes when we realize we need to seek education and learn more, we show up to, presentations like this, right? We read, we ask questions, we show up to some cultural competency training, which are important. But I think that some of these models, when we show up to these types of trainings, we have to think about how they can be improved in a number of ways. So for me, like, I believe a lot of changes come when we learn more about ourselves and disrupt our sort of taken for granted assumptions about the world and our place in it and where our beliefs come from, which is why we started with broader beliefs and ideas about gender. We have to understand where they come from so that we can, sort of change them and move forward. Also, they often teach us about a population, which is important, but they forego intersectionality. And I think that can create what I would say a false sense of competency. We go to a training on gender or race, right? But we rarely talk about when both of these things and other, identities like, abilities, like economic status, those types of things are in the same person. And so we'll come back to this point of intersectionality a little later as it relates to trans folks specifically. And I think that these trainings can also privilege that a particular identity, such as gender, right, or race or class, is the one that's primarily driving experiences. So just, if a trans folks person comes to see you, they may not be coming there to see you specifically as something related to their gender identity, for example. And then also how each of these identities can separately and together privilege and marginalize folks in certain contexts. So it's important that as you're attending all these trainings and learning about different populations, just remember sort of how they sort of all work together. So I think that's important to remember. And then also with trans folks in particular, in trainings, we also tend to want to learn about terms. What do these terms mean? And there's a ton of resources out there with the definitions attached to these particular terms that you can look up. They're important to learn. And when folks learn various terms, the danger is I teach you a variety of definitions like gender queer and non-binary, broad terms for folks who identify with both genders or neither gender. And you apply that to each individual that you think falls into that category and assume they use those very same definitions to define themselves. But the trans experience is very singular to each individual who has a different relationship with identity and desired outcome of social and medical transition if that's something that they're pursuing. The bigger lesson here is that language matters, whether that's the terms folks use to describe and understand themselves as a gendered person or not a gendered person, or the pronouns that they use. You're better off talking to folks and asking questions, learning the terms they use to describe themselves and what those words mean to them as individuals. language is limited. There's not a lot of words in the English language, right, that describe all these sort of, you know, different kinds of bodies and styles of expression. And we shouldn't have to simplify ourselves to neatly fit in the box that's been given to us, right? Let go of people fitting neatly into a definition, right? The entire point is to be authentic and not trade one sort of socially confining stereotype for another one. Right? But again, language matters, right? Living struggles accelerate changes in language. People need and use language to understand and grasp their experience, to grab onto that word and say, hey, me too, right? So for example, a lot of people think that somehow there's more trans kids now, right? Excuse me, there's not. There's just more narratives, right? There's more stories out there. There's language for people to grab onto and understand their experience as trans, right? They can use language to access part of themselves that they didn't understand before, and that can save someone's life. So, you know, it's important to learn the definitions, but also understand sort of the limited aspect of that. And if you really want to get to know your patients, your clients, whoever, right, whoever you're working with, is to really ask them what that means to them. And also related to language, you know, we hear this word transition a lot, which is the process of affirming gender identity by making outward and inward changes, a period when a person makes social changes, legal changes, medical changes. It could be coming out, changing names, pronouns, gender expressions, sometimes gender confirmation surgeries, hormone replacement therapy, and not all trans folks seek these changes. I think there's a overemphasis on gender confirmation surgeries, particularly like bottom surgeries, things like that. And you know, only about 1 to 3% of trans folks are getting any type of, you know, sexual or bottom surgeries, right? General related to their genitals, right? But transition in particular is a tricky term, right? It implies you're becoming someone else. And the hardest part, I think, is to make people see you aren't changing at all, right? You're just trying to become the sort of most authentic version of yourself that you can be, and share that with other people. That's kind of more of a revelation than a reveal, which I think can kind of lack dramatic effect for some. So we're going to move on to, like, before we get to the specifics of being affirming providers, does anybody have any sort of like questions as far as like clarification goes or anything? We'll have some time at the end for questions also, but I just want to make sure that we kind of check in.
Just two things I thought about as you were talking is that there's actually research that shows that by using like the correct pronouns can actually reduce like youth suicide attempts, which I think is really, you know, critical. And then the other thing I was thinking about when you were talking about media is that sometimes even in television shows or something like that, that's supposed to be affirming in some way to LGBT language, or somehow, you know, supposed to support allyship, you still see a difference when it comes to trans issues. Because like I just watched like on YouTube, there was this thing on Will and Grace, which obviously was a huge thing, and like Karen started to refer to somebody else's he she qualities, like that was a dig at transgender. Like it just was, you know, and yet that has always been kind of heralded as a really important show about that, that, you know, push forward LGBT issues. So I just think that it also seems to me that even when there's a lot of media that is supposed to be supportive, it still seems like transgender folks still, even in that media, still sometimes get mocked.
Yeah, thanks for those comments. Pronouns actually, 100% help improve sort of the ideation and youth. Obviously, if we're using language that just like sort of lets folks know that we see them, that we recognize them, and that we're affirming like who they are, right? Like that, I think that helps with everybody. So like, great, yeah, like, and I don't know why that's always such a shock to folks. We'll talk about pronouns again in a little bit. And then TV, that's affirming like Will and Grace. Again, there's this idea, I think, that like if we're being affirming of gay folks, right, like we're also being affirming of trans folks, or that, you know, that like, you know, even trans folks are 100% affirmed by the like, you know, gay community, and that's not always true. And so I think that's why we see those differences, and there's still those digs, right? that we see. So yeah, I think those are two great points that you brought up. So thanks for pulling that out, especially particularly because we're talking about media and things like that too. And also, I noticed too when you were speaking, you said about trans, and then you said, oh, trans issues. So like also when we use language, remember that trans, I think a lot of times people use trans as a noun, a transgender, the transgenders, right? But think about it, it's more of an adjective. So transgender populations, transgender people, things like that. And I did too sort of kind of like recognize that too. So I think everybody, you know, like as we're thinking about like how we use those terms, is a good way to do it, but also, yeah, the sort of LGBT sort of unification is an assumption that's not always true. Other questions or comments?
I also just want to second, I think Casey mentioned the movie Disclosure on Netflix. I really recommend people checking it out if you're interested in how the media has really shaped the general public's ideas about trans people. So
Right.
a second push for that.
Yes, thank you. I feel like I haven't watched it yet, but I didn't. Great. I've written it down.
Yeah.
All right, so we'll move on to the next thing and then we'll save some questions at the end. But again, as I'm talking, if y'all have questions, just kind of like speak up and we'll do it that way. It's hard to read a room on the interwebs. So we're going to talk about some things that we can enhance our trans and gender expansive affirming care practices. And we're going to talk about clinic environment, symbolism, documentation, policy, language, and we're going to focus mostly on knowledge, but we're going to talk about some of these other ones first. So first, clinic environment and symbolism. This is what's in our office space, our marketing materials, our handouts, bathroom access, or maybe our rainbow lanyards or pronoun pins that we're used to seeing. Does your paperwork have opportunity for people to put their gender identity on there, their pronouns on there? Do you have, signs, marketing materials, other things that let folks know that they're welcome in a space? And then related to that, the documentation and policy. Our SOGI boxes, sexual orientation, gender identity boxes, and electronic medical records, our rooming policies, right? Our anti-discrimination policies, which we'll come back to in a second. And these two things, the symbolism and then our changes in these policies, right, is this difference between this idea that all are welcome and this was created with you in mind, right, and changing the systems that you're working in. So we have this symbolism, right, our rainbow lanyards, for example, our pronoun pins, and these sort of performative aspects of showing someone that they're welcome, and the actual personal and systemic changes that need to change, right? So maybe you want to wear your rainbow lanyard, you want to wear your pronoun pin to symbolize your acceptance, right? This is that performative aspect. But are you willing to have, as you're wearing that pin, right? Are you willing to have conversations with coworkers and administration when you see people making mistakes? Are you asking every single patient their pronouns? Are you avoiding the assumptions about who you should ask, right? Are you working to change paperwork and systems that, make those spaces more inclusive for trans folks, right? So for example, and this I think is a really important point in the current situation is going back to anti-discrimination policies. So recently we saw the removal of non-discrimination protections for transgender and non-binary folks in healthcare. Sex discrimination now only applies when someone faces discrimination for being how we understand female and male, and does not protect people from discrimination on the basis of sexual orientation or gender identity. So though it was already happening, this now means it's okay to deny not just transition related care, but also general primary care, right? Treatment for cancer, insurance coverage, any type of other medical care, language and translation services related to healthcare, emergency services from paramedics and first responders, right? Many more like it. So, but this doesn't have to apply to your practice. So now what are you doing to let people know that you and your practice do not follow that your space doesn't allow for this type of discrimination? I do encourage all of you to put out a statement, whether it's in a newsletter, in your, in your office, through emails, social media. Like, how are you letting people know that they're welcome, when the larger, broader message is that it is allowable for folks to deny trans folks care. And and it's not covered in non-discrimination policies. So for example, I work for the LGBT Center of Excellence at Denver Health, and our marketing department is putting out a large statement to just the city of Denver, the folks that they serve, that Denver Health is still open and welcoming to trans people. So again, it's important that that's coming out now because of the larger messages that we see happening. So that, again, that the sort of difference between the sort of symbolism, these performative performative aspects that, you know, visually show people that they're welcome, and then how we're actually changing our systems. And related to that, you know, knowing the barriers to care for trans folks, you know, we saw these things happening obviously before this law was changed. So it's not new, but it does make it harder to access care. It does make it allowable to deny care to somebody. And this is a survey from, excuse me, Colorado a few years ago, where we saw, you know, 25% of trans folks being harassed or disrespected in a healthcare setting. Some actually report being physically assaulted. 50% of trans folks are reporting teaching their provider about their own healthcare, even basic primary care. We also see that, see this quote at the bottom, doctors insist all my medical problems are a result of my transition, even though they predate it. This is what trans folks will call trans broken arm syndrome, meaning like everything, that problem that we see, medical issue that we see trans folks faced with is often blamed on their transition. And also, again, as we're going through slides and looking at statistics, it's important that, excuse me one second. It's important to remember that these are probably underreported. We don't collect data on gender identity in large population surveys. Most of this comes from community surveys. And so, you know, we're not, you know, it's not a large number of people filling these out. And also selects where people have access to these types of surveys. So they're probably not, you know, getting data from like really rural folks or something like that, which can also help, you know, like sort of underestimate the numbers that we see. And also related to barriers, because of this sort of like discrimination and things like that, we also see a lot of, you know, over 40% of trans folks delaying access to healthcare. So just like, I've been being discriminated against, so, you know, like I'm just not going to go to the doctor, which then of course results in a number of other health issues. And also when we think about care for trans folks, there's this overemphasis on trans-related care or transition-related care, hormones, gender confirmation surgeries, and things like that, and not a lot of emphasis on just like folks accessing general health care. So we see this quite a bit. And, you know, continuing, I guess, you know, so it's important to know these barriers, and then continue our sort of conversation about language. You know, these are some of the first questions I think people ask, you know, people ask in trainings when working with trans folks, is about language. What do I say? What do I do? Right. And so the first part of that is avoiding assumptions about gender identity based on the way someone looks. And also, you know, just not asking, just not asking people who you assume that you should ask about pronouns, but asking everybody that you come into, you know, make this part of your sort of, you know, routine that you sort of talk with everybody. So one of the things is just moving to more gender neutral language. So can I help you, sir, right? Maybe we could just say, can I help you, right? So it takes the sort of gendered aspect out of that. Or she is here for her appointment. We can say the patient is in the waiting room, those types of things. So learning how, you know, practicing how to take the sort of gender out of the language that we're using and making it more gender neutral. And even these bottom two, I think, apply to both not just sexual orientation and gender identity, but also really just anybody. Where are your mother and father's names, right? What are your parents or guardians' names? Like that's true for a lot of folks who may not have a mother and a father, or may, you know, may, or maybe are being, the guardian, is there, somebody else, or do you have a wife, right? This assumption about who we assume people are with, right? Are you in a relationship? Do you have a partner? So just like paying attention to our language, how we use that every day, and the assumptions that come along with it. And then with trans folks, this sort of, again, this should be with everybody, but trans folks, I think, allow us opportunity to really think about this language in a different way. So affirming name, so the name somebody identifies with and wants to be called, and use, and this is regardless, of course, of their appearance, their surgical history, their legal name, right, their sex assigned at birth, and then asking somebody's legal name. What is the name on your health insurance or legal documents? And this isn't just true for trans folks, right? There are many people who don't use their legal name, who would rather be called a different name. Maybe they use their middle name, maybe they've changed their name for a variety of reasons, whatever it is. So this is, again, it's important to ask everybody that you interact with, what name would you like to be called? What is the name on your health insurance or legal documents? The other part of this, particularly in healthcare practices, is make sure to communicate name and pronouns to other staff. So like if you're front desk folks, you can be the most affirming provider in the world, but patients have to go through a lot of people before they get to you, right? And so, like, is your front desk person asking this? And then how does that get communicated to the MAs or the folks who are rooming folks? And how does that get communicated to the provider, right? Like streamline this process so this person only has to sort of go through this once, right? And they don't get misname and mispronoun along the way. Like, how are you communicating it to each other and making sure sort of everybody's on board with making sure folks get, called their affirming name and pronouns. So come up with a procedure to streamline that. There are even the little tags, the little stickers that y'all, if you print out when people show up and you stick it on all their files, like you can put affirming name on those. You don't have to just put legal name on them. Same thing with pharmacy labels, stuff like that. Joint Commission has specific rules about that. So figure out what the rules are where you are, and you should be able to make those changes so it's easier to see affirming name on labels rather than legal name. With pronouns, this is something people get stuck on quite a bit, or are worried or not sure how to ask about. So build that into your introduction. So, hey, hi, my name is Ryan. My pronouns are he and his. What pronouns do you use? Or what are your pronouns? These are ways that you can ask these things. And the more important part of this is, which pronouns are valid. Whatever pronouns somebody tells you, if you decide you want to respect them in the ways they're acting respected, that's it, one bullet, right? Like we learn hundreds of names, we can learn pronouns if we want. So remember also excuse me, if someone has felt comfortable enough to ask you to refer to them by different pronouns, that's a big step for them. And the way that you proceed is really important. To say that is not a real pronoun or is to say, I don't respect you. Your identity experiences are not valid to me. I hate this refusal to use they, them pronouns because of the grammar argument. One, we use they in the singular all the time. When we didn't know who the whistleblower was, we wondered who they were, right? We find a phone at the gym, we might bring it up to the desk and say, someone lost their phone. But for argument's sake, let's just go with the grammar excuse, right? One, the rest of your grammar better be spot on. I don't have room for excuses that worry only about the sort of meticulous of grammar rather than the lived experience of another actual person standing in front of you. The literal meaning of meticulous is being careful out of fear. And fear feels like the wrong feeling in which to start making connections with folks and getting to know them. It's not minding grammatical rules, but care for the words that allow others to know that I see them, right? That I respect them, that counts. And so saying I respect the English language more than I respect you or this person that's standing in front of you means I need to get my priorities straight. So this is the one thing that I don't have a lot of space for when it comes to people like with refusal to use, particular names and pronouns. And so with pronouns procedure, also people are always really worried that they're going to mess up, and you probably are. And as you're sort of getting used to, changing your language to be more inclusive of everybody. So when you mess up, just apologize, just correct yourself and move on. So he's here, oh, I'm sorry. she's here for her appointment, and then I move on, right? Saying, oh, I'm sorry, right? And doing this sort of over apologetic thing to somebody makes it about you. And then that person has to take on the responsibility to tell you that it's okay. So just a simple apology and correction and moving on is the best way to proceed. And if you have time at the end, like if you want to say, like, I recognize that I did that, I'm really sorry, like, and just sort of, call that out for yourself is okay too. And the other part is it's okay to mess up. Like, you're going to mess up, but recognize that if and when folks still react negatively to you, they're probably reacting to a lifetime worth of having their identities being invalidated. And it may not seem like a lot to you, but that person has probably heard that a million times, probably 10 times today, and all of that adds up. And so it's this idea that, like, one time we get a cut, and over, again, that's a wound, that's a scar, right? And so know that when trans folks are coming to you, they're also showing up with all these other experiences, and you can contribute to that, or you can change it. And so when we're talking about these other experiences, we see all these other obstacles. So this final aspect of affirming care is knowledge and knowing about. So knowledge isn't just clinical knowledge, right? It's learning the realities of everyday life that trans folks face outside of the sort of confines of your office or organization. So, even just during COVID, for example, for those seeking any type of gender confirmation surgeries, COVID, this is considered, they're all considered elective. And so, for example, we've had folks on waiting lists for 3 years for, different surgeries who are, now put on hold for an undetermined amount of time because they're considered elective. Or, we also see, these other sort of larger obstacles outside of healthcare, right? Employment, job discrimination, poverty, sex work as survival because of job discrimination and unemployment, legal obstacles because of lack of identity, documents, things related to parenting rights, lack of health insurance, violence, abuse, homelessness, unsafe restrooms, unsafe schools, these types of things. So there's a lot of sort of things in the way for folks. And this is these obstacles are some of the reasons that we see 45% of trans adults 18 to 45 with at least one suicide attempt as compared to about 4.5% of the general population. Again, this data is probably underreported. So this is more than pronouns and language, that is the one thing that, I find providers worry the most about asking, but I say, educate yourself about these bigger contexts, because that's really what's driving these numbers. And also with, disparities, we know trans folks face a number of health disparities, right? Mental health, suicide, substance use, tobacco use, this, again, sort of delay in healthcare. And again, this issue is the issue here is underreporting, and we don't have the kind of surveillance for trans folks that we see for other health statistics. And the other part of this is when we look at health statistics, we're not really privy to the intersectionality of these health statistics. And for me, HIV in particular illustrates this really well. So this top right part of the side, we see, again, this is probably, somewhat underreported, but we see about 1.4% of trans folks living with HIV. This data comes from the Trans Health Survey, which is about 5 times the US population, which is 0.3%. Black trans folks, 6.7%, and Black trans women, 19% living with HIV. So this goes back to the conversation about what identities we privilege in certain scenarios. And avoiding assumptions that someone's gender identity is a primary identity driving their experiences, because they're trans. This assumption misses this bigger picture, particularly when certain identities become marginalized and privileged in different contexts. So this rate, for example, these types of health crises are caused by larger social environmental factors, such as, but not limited to, things like underemployment, housing insecurity, inadequate access to healthcare, intergenerational health inequities, systemic racism, historical colorblind approaches to the AIDS epidemic, things like that. So intersectionality matters. So related to that, excuse me. I'm a trans man. My whiteness and binariness means the chances of me being being beaten in broad daylight by a group of men is unlikely. Being a trans woman of color, the chances of them making it to 35 is also unlikely. Of the known trans folks who are murdered every year, almost all of them are trans women of color, and specifically Black trans women. So these are some of the photos of the trans women who have been murdered in 2018 and 2019. 91% of them are Black women and 81% of them are under 30. In 2020 has already seen, at least what we know, at least 15 trans folks fatally shot or killed. And these two women were shot in the last week. And so I think, this is what we see happening all the time. This is what we need to start paying attention to. This is like really knowing the realities of the lives of the folks that are coming to see you is really important, whether it's to them or their friends or just more largely to the population that they are relating to is important to remember. Each year there's Trans Day of Remembrance also, where folks get together and read the names of all the trans folks that we've lost by homicide and the murder in the last year. And so also, this weekend, we're coming off Pride weekend, which most events got canceled due to the COVID. And Pride has historically been a recognition of the Stonewall riots. Which, was sort of the first riots that we saw when we first saw trans or like LGBT folks sort of fight back against sort of groups of folks, police, society, and stuff like that, sort of silencing them. And most of the time, my animation didn't work, but most of the time, like on mainstream TV, we saw Stonewall sort of being represented by white men leading the way. But these photos are representation of the erasure of Black trans women. These are the people who actually helped start the Stonewall riots. These are the group of people that were at that bar that we talk about so often, but rarely talk about the people who did it. And so these are the faces of Stonewall. Most of the people were drag queens, trans women, and gay men of color. Marsha P. Johnson, Miss Major, Sylvia Rivera, many of the house mothers of the 80s and 90s. These are the people who fought back and demanded rights for queer communities, and the ones who laid the framework for sort of rebellion and allowed the LGBT movement to go forward, but are often erased. So for me, I think the cancellation of Pride this year is a bit of a blessing and happening alongside the current sort of Black Lives Matter protests and attention to Black lives. This allowed those who've sort of ignored this history to be able to kind of step back and pay a little bit more attention. And I think that sometimes folks ask me to do these lectures because I'm a trans person and I speak to my experience, but my experience is completely privileged. And my transness is not sort of available to people. I can't speak to other experiences. I do try to share parts of my story that I don't think get told when we talk about trans folks. I can't speak for everyone. One of the hardest parts of my transition is the fact that when I'm not interacting with institutions that they know that I'm trans, and when I'm with my partner, I'm being perceived as a highly educated, straight, white man. And I don't use those words to describe myself, but the world sees me as that. It projects it upon me. And I need to learn to respond to all the assumptions with the category and understand my part in a system of inequity. Transitioning in as an adult is weird. I'm not only going through, I just turned 40, but going through puberty in your late 30s, the social world doesn't really give you any air in what's expected of me as an adult man. Sort of being thrown out of a helicopter with dull knife and kind of good intentions. And when the world changes when you change how the world sees you as a gender person, it absolutely changes how people interact with you. You want to talk about gender inequities in workplaces, talk to trans folks who have transitioned as adults and interacted with the world differently. my female body put constraints on me, but my male body puts different ones on it. So for example, one time I was walking to a coffee shop. There was a woman walking in front of me, maybe you know, I don't know, 20, 30 feet, whatever. And she kept, after a while, she kept turning around. She noticed that I was there. And it took me a while to be like, oh, like I'm a threat now, right? And I didn't have to worry about that before. Before it was opposite, and so now I have to be aware of my sort of newly weaponized body in a way that I hadn't before. I'm a threat now in a way that I wasn't before, and that escape from the sort of female label and body, sort of that escape from this restrictive box, has allowed me to kind of hold it out in front of me and look at it without feeling claustrophobic, and it looks different. And I don't have to distance myself from the parts of me that are feminine. I sort of embraced this before. I rejected so much of that, and now I sort of embrace this sort of like feminine masculinity that I have, and I think I have also space to speak to what that means, as being moving through the world as being perceived as male. And what I've learned is we also all have been taught to sort of internalize our feminine qualities, or less than gender identity aside, and being perceived as a white man. Like, what do I do with this privilege, that's been handed to me? What's my role? What's my responsibility to break down and talk about gender more broadly, and race and intersectionality? I can't speak to what it's like to be a trans person of color. I can't imagine what it would be like to walk through this world being perceived as a Black man, as a trans woman or as a trans woman of color, right? I've been trying to learn, some of the resources I've been engaging with most recently on YouTube is something called Black Queer Town Hall. You can access this through, I think, the GLAAD, GLAAD, on YouTube, and it's put on by some drag queens. But the other day there was a lot of Black trans folks speaking to their experience, and there's also a lot of sort of trans academics, Kai Green, Teek Milan. There's famous authors, right, who speak to Black trans lives that also fall under the LGBT umbrella. So also on the Black Queer Town Hall, Angela Davis was just on the other day. So I encourage you to, sort of pick up books and read them, and watch, these videos. And, as you're seeking education, take that labor off trans folks, take the labor off, Black and brown folks. Like, you have the ability to read books, you can do the research, you can ask questions, you can listen, and don't put it on, trans folks, don't put it on trans folks of color to do the work for you. Like, be accountable for it. Watch these, these movies, those types of things that people are suggesting. And that aside, like, the trans experience is more complicated than this narrative of gender confirmation surgeries that the social world has given you. So although I do still, they do still sometimes play a part, it's not as foreign as people kind of make it out to be, when I tell you that we all change our bodies to be more comfortable, and then we all look in the mirror and wish our bodies look different ways, or feel uncomfortable with it, and we go on diets, and we work out, and we do plastic surgery, and we get tattoos and whatever, and we all do that, and so society tells us how our bodies need to be, and we all internalize it. And so it really, thinking that trans folks seeking different types of surgery is the strange thing is really no different than other folks being uncomfortable in their bodies. Which also, coming back to language, when we're learning and wanting to be more affirming providers, for example, like, we too often focus on immediate practical problems. So this isn't just about shifting our language. This is showing up and say, now I know how to ask about pronouns, right? This is about shifting your entire paradigm, about deconstructing your ideas about the social world, what it's giving you, and what you believe about people and identities. There's no shame in admitting that we were previously speaking from a less informed place, right? There's a lot of information out there, and we all don't know any of it, right? For me, like, empathy and humility are skill sets that we all have to work on. And so next time they interact with a trans person, instead of worrying about what to say, or that you might mess up pronouns, right? Take 5 seconds to just step back and ask yourself why you're changing your language, right? And your habits. And I promise that all the other stuff will come easier to you. Recognizing that lived experience of folks outside of our sort of immediate medical problems and practical problems, we're going to get you much further. Being an ally is not an identity that you give yourself, right? On the Black Queer Town Hall the other day, there's this trans man said, Teek Milan, and he said, guilt is never useful, right? Only your solidarity for people who are not like you. And I just thought that was so to me so powerful, right? And for me, transition has been a complete gift. Sometimes people will be like, oh, do you wish you were born male? And if that, assigned male at birth, would that have been easier? And to me, absolutely not. Like, I am who I am because I'm a trans person. And I try to use my privilege of, being perceived as I am, and the fact that I've been accepted by my parents and my partner and my friends in school and work and whatever. And I have not faced what other trans folks have faced is the reason that I do lectures, is the reasons that I'm out. And I also think that, like, being a trans person, there's this, like, I don't think that you will meet a trans person who's not sat back and really thought about who they were. I remember when I first started transitioning, my counselor, she was like, Ryan, you have this really beautiful opportunity to really kind of question who you are in the world in a way that most adults really don't get to do. And, being trans is this sort of introspective process of self, I guess, awareness that most people don't get a chance to experience. To really decide and know who you are. And it's made me more empathetic and recognize that we're all going through some story, some invisible transition that we're all too afraid to talk about. And so recognizing that my own story is not that different from yours really is the first step in not only inclusiveness, but the beginnings of bridging the sort of increasingly polarized world. So I think that when we think about what we want to do, like building this culture of accountability, like really, having conversations with folks and being okay to say, like, I don't know, or I'm wrong, or here's what happened. And, here are, with my interaction with this person, what do I do? And practicing that and being aware of the language that we're using and how we're interacting with people, and questioning, what we think we know and where that comes from. Remembering that there's more to trans and non-binary folks than hormones and surgery. We did focus mostly on trans folks, not as much on non-binary folks, but not, this transition-related care is not part of everyone's relationship to their body. And it's also not accessible or affordable to everyone. And now that we see with the the non-discrimination policy, just removal of protections for trans folks, like even legally, trans folks aren't protected by this anymore and can be denied. Don't fall into the trans broken toe phenomenon, trans broken arm phenomenon. Like, don't, assume that just because somebody's coming to see you and they're trans, that they're there to see you as something related to their gender or their transition related care. This is particularly true for not just, sort of physical medical type of doctors, but also like mental health practitioners. Always ask name and pronouns for everybody. What name and pronouns would you like me to use? Not just people that you think. Remember that identity is personal and never assume. Everybody's experience is different. Everybody's going to use different terms. I mean, I'm again, like, even, I teach undergraduates, and so, like, even sort of that generation, 20s, they're using terms that I have to ask them what it means. And so, like, obviously there's a generational change in language, and so those terms are also gonna change based on the age of the people that you're working with. And then, be accountable, educate yourself. I'm happy to share a number of resources, books, websites, things like that. But, I think that, just really kind of seeking out that information, and also, asking other, find other, maybe public speakers like myself, trans folks of color, to do lectures, because they're going to give you a 100% different perspective than I am. And thinking about your systems and how that sort of lines up with just like your own sort of, accountability. And then I have to say also that, so this Mountain West AIDS Education Training Center, I'm part of the Interprofessional Education Project, but ARTH is also partnered with the AATCs, is supported by HRSA, so Human Resource Service Administration, and the US Department of Health. And the content of this presentation, of course, are of myself and doesn't represent the official views of the organizations that fund these types of things. So I do want to have a lot of time for conversation and questions. When a trans person gives you opportunity to ask questions, you should take it. And don't be afraid to ask them in the language that you have. And even while you're, why you, maybe we can talk a little bit why y'all showed up today. Did you get what you're looking for? Can we sort of clarify some of this other, questions that you have?
Hi, I don't have a question. I just more like something to add. But I first just want to thank you for your presentation. I thought it was super helpful and really interesting. But I really appreciated the part about like pronouns and making assumptions or not making assumptions. And I think just to think about assumptions, I have a quick story about my sibling who's non-binary.
Awesome.
Yeah, we're both non-binary, and my sibling was getting top surgery, and the doctors and nurses all referred to my sibling using he, him pronouns, which in a lot of cases that would have been correct. But for them, they, them is correct. And I think the nurses and doctors were really trying to be sensitive to preferred pronouns, but they kind of missed the mark and ended up creating kind of a harmful experience for my sibling. And so I don't know, I think it's interesting because even if you are thinking about trans experience, it's just important to realize that there's like a whole spectrum and different pronouns and different terms. So just like emphasizing that and adding a little story for people to think about.
Yeah, Hunter, thanks for sharing that story. I think it's really important. And you said that this was when your sibling, they were seeking top surgery. And I've actually seen this happen with some of other folks that I've talked to, where not only are they getting misgendered, but they are getting misgendered while they're there for a surgery that is related to their gender. And so I think that is really a time that, like, of course we want to make sure that we're careful with pronouns all the time, but when somebody is in there for something related to their gender and they're beginning misgender, it's like, what is happening? Where's the breakdown, right? And so I think that was a perfect example of bringing that up. And also your comment about the kind of like this spectrum, like trans people aren't just falling back into the binary. There is this, and non-binary people, don't look the way that everybody thinks that they're going to look, and people can look, like they're falling back into the binary. There's this really great article that I just saw in one of the y'all sent out resources, and there was an article on why I don't use, it's something about it being non-binary and the use of they, them pronouns, but it was the intersection of bodies and race and things like that. It was done really beautifully. So I don't know if you have maybe good resources for folks for non-binary populations that you think would be good for folks to check into.
I don't know if I have any off the top of my head.
Yeah, I can share some. I just like to ask, like, yeah. Other comments, questions? And I do think personal stories really help folks. Thanks for sharing that too.
Yeah.
Hello, can you hear me?
Yes.
Hi, my name is Josh. I'm at Gay City. So thank you very much for your presentation. But I think I missed one thing. I don't know I think I missed the broken toe phenomena. Like, could you, do you mind elaborating again, or if not, like,
Sure.
just sending me a quick link?
No, I can explain it to you. So what we see often is trans folks will go to medical providers for an unrelated sort of health issue, and that will be blamed on the fact that they are transitioning. So the trans community will often call this like trans broken arm syndrome, trans broken toe syndrome, like my arm is broken and it's being blamed on the fact that I'm trans. So like avoiding blaming transition on other health issues or on health issues. Does that make sense?
Yes, that is perfect. Thank you for elaborating that again to me.
Mm-hmm. Hard questions, comments. We gotta wait for people. Hi.
Hi, I have a couple questions.
Sure.
One, I noticed that a lot of times when people are talking, they're using the word like folks, and I understand the reason for that. I tend to say like, hi, everybody, or like, people. And I'm wondering if I'm signaling anything by not saying the word folks, or if it's just preference, if everybody and people is fine or
Yeah.
not. I just wonder if there's any sort of like messaging I'm sending by not using that word.
Yeah, so that's a great question. One, I think it's good just like, to question it, what kind of messages I'm saying that maybe I'm not aware of. But I think just the use or everybody or people or whatever is fine. Just those sort of gender neutral words, those like all encompassing words versus like all the guys and girls in the room or something like that, right? Like, and so like, or I'm from the Midwest and I used to use guys all the time, hey guys, like as a term for everybody. And then I started using folks because I moved to New Mexico. So I think those difference between like folks and everybody or whatever is kind of like regional and not necessarily, like using everybody doesn't imply anything. And so I think just those broader terms are good to use. So I would say that you're doing the right thing with the words that you are using.
All right, and then I have one more question. Do you have preferred resources for just like not just books about, like the process of going through transition and affirmation, but just like people living their lives and sharing their experiences?
Sure.
At work, I work in a medical setting, but like at home, I have 4 children who are like 15 and under. And like when you Google things, sometimes it's hard to know which things are like inclusive and which things are maybe not quite as inclusive.
Sure. So I can put a list together and send it to the ARTH folks, and they can send it out to everybody. But I can put in like the sort of personal experience narratives that folks are writing, and then I can also put in resources specifically to give to younger kids and teens and younger kids and things like that. That would be good. And I think that's good to question, like what are the good resources out there? And also, I think especially for kids under 15, there's actually quite a bit of really good stuff like on YouTube and what is the other one? TikTok that kids are using now, things like that. And so I'll send some of those too for folks to pass along. So yeah, if y'all have, I'll keep writing things down of all the lists of resources I can send out if y'all have other specific topics you want me to pass along. Other questions? It could be about my own story. It could be about working with trans folks. It could be anything. Everybody's got to come back in from letting their dog out.
I have another question.
Sure.
So I am a social work student at the University of Washington, and so I'm just kind of starting out in the field. And I guess I'm wondering how, I don't know, like entering like a medical setting or like a social work agency, if there really isn't a culture of gender inclusivity, but like I am using like a lot of gender inclusivity, what are like suggestions of like ways to bring that into the space, especially being someone who is non-binary? So it's like, it sucks that like it has to be on me a lot of the time. But I guess I'm just wondering if you have any like suggestions of like how to influence culture or how to bring things up in like a gentle way in a staff meeting or anything like that.
Yeah, I think that's a great question that we're all sort of still navigating. So I can kind of give my perspective, and if others here have like some ideas related to that, I think this is a good conversation to have. And so again, like I think it is hard for, like I have one of my friends, is sort of taking it upon themselves to get people to talk about non-binary experiences more, both in their like program and in their work and things like that. And so sometimes that's hard to like also, kind of giving yourself the space to try to take that on because you think it's important, but also recognizing the sort of your own emotional work in that. And so I think that's good to figure out for yourself. But some of the things that I found is like trying to, make connections with some of the folks that are your sort of leadership, the folks that are making those bigger changes that are going to make it. For example, I'm doing work with a resident right now who works in a primary care practice, and they were really sort of dedicated to trans populations. And she got a grant to do this project and work with like sort of her mentor, and then they pulled in some of the leadership there that allowed this training to happen. And so I think it's, who are the folks that you can connect with that are going to be the decision makers that are going to push these trainings, that are going to have opportunity to make those large, create those larger conversations. System change is hard, especially I think in medical settings, right? People don't want to change what they're doing, and there's a lot happening, and people are busy. So it's like, yeah, who can you talk to so you don't feel like you're doing it, you're on your own, like you're not responsible to make those changes, right? They are, but you can, start, I think, trying to talk to people and finding, maybe other coworkers first who can then go to leadership if leadership isn't necessarily first.
I'm not sure if I froze or if you froze, but I missed a little bit.
Yeah.
It might
It might, yeah, I don't know what, okay, so I'll just say, I was just asking folks, like, that's kind of been my experience, but have other folks sort of worked with their practices on making change, or some of the pushback folks have got, or anything like that? I was trying to see if others can share some of their experience related to that.
I think, the one good thing about like social work, so I'm a counselor, is that at the very least, you have the whole of social work behind you in terms of their the National Association of Social, like just the whole your code of ethics, and that's kind of important. So you have a tendency to have a profession that in general is more open-minded, has a little bit more awareness, although not everybody or every specific person, but I do think they're trying to incorporate that into the training. And you're right about medical facilities, because obviously you're in there with an interdisciplinary group, and not necessarily as so, sometimes just by going in there and being authentic is one of the best testimonies you can do. And so, and I think the other thing is it does require a little bit of patience, because sometimes the needle moves slower. But I think it's also really important to speak up whenever you feel like something needs to be said. I think it's challenging because, sometimes we have to take internships in places where they're available, but if you have the opportunity to choose, doing a little research on that agency ahead of time and what they're doing and what their website is like and what their messaging is, and talking to people who might be employed there, and if you can, to select places that are already involved in the work is obviously going to make things easier for you, to be able to have those because I personally believe that that's a culture that's built at the top. If you need to have leadership and administration who are interested in having that, are interested in building a culture of I hate to say diversity and inclusion, because I feel like that's the thoughts and prayers of but they're trying to build a culture that really does seek out other folks' experience, and try to broaden out what they're offering, both for their patients and then also for the folks that they employ. So if you have a choice, I feel like sometimes it's good just to do some research and see, can I get into a place that already looks like they're involved in it?
Yeah, and I think, Robin, some of the stuff that you said, like the discipline ethics or the interdisciplinary team, sometimes when we're talking to groups who maybe aren't quite on board yet, how do we get them involved in the conversation, right? How do we get them interested? And some of that is not speaking to what we care about, but speaking to the things, starting where they're at. How do we get them involved, right? So here's the disciplinary ethics. Here's the things that said that, this board of whatever the national sort of accreditation rate, whatever it is for social work, this is what they say, like, why aren't we doing this? Those types of things, or speaking to how people interact with interdisciplinary teams, right? Or how, folks work together for patients and why that's important. And so, yeah, you could go somewhere where folks are already doing that research, like to make yourself feel safe where you're working, right? Because that's important for you. Or, like, what does it look like to go in a space that's not already doing that? And is that something that you're ready to deal with now? Or so maybe you want to be in a space that works with, that is already inclusive, then you know how to sort of make suggestions for those changes to happen in places maybe that aren't. The kind of squeaky wheel thing, but yeah, I think those are great suggestions, particularly for folks, coming new into a field or something like that. Other thoughts? Thanks, Robin. That was great.
Yeah, we still have some more time for questions, so I'll give folks a few more minutes to think about anything they might have.
Hard questions, other resources I should send along. Other social workers in Seattle that Hunter can connect with.
Well, I'm in Portland, so at least I have your same time zone, Hunter.
Yeah.
Yeah, it'd be great to connect. I don't know if we have like emails or whatever from AARTH.
Yes, I will include, if that's okay with you, Ryan, I will include your email in the follow-up. So there will be a follow-up email with some of the resources that you all requested, and also a post-evaluation. So please take 5 minutes to complete that evaluation. It allows ARTH to be able to offer these presentations for free to you all. And yeah, if there's no more questions, I think that we can end a bit early.
Hunter and Robin, I wonder if can you message each other from Zoom? If not, y'all can both email me and I can connect you that way, but I think you can private message each other.
It looks like the chat is disabled for this
Oh,
call.
okay. All right.
Yeah,
Well,
I don't know why, but they've been disabled on the
yeah.
webinars we've been giving. But
If y'all just email me, or Linda can share my email and then y'all can email me and then I'll just send it out to the two of you and do it that way. I don't mind doing that.
Okay, sounds good. Thank you.
all right, thank you, everyone. Thank you, Ryan, so much.
Sure.
Bye.
Bye all.